A very good afternoon and welcome to our session on the topic post-menopausal bleeding and endometrial cancers. We are glad to have Dr. Hello,
Yes.
one second. We are glad to have Dr. Anshu Rena with us today. I would like our doctor to take this forward, and you have the stage now.
Good af- Good afternoon, everyone. Today I would like to talk you about important issues that affects a elderly woman, that is a postmenopausal bleeding and endometrial cancer. Myself, Dr. Anshu Rana. Right now, I'm heading a department of Apollo Cradle Hospital, Greater Noida. So this topic is very, very important for an elderly lady to know about when to come to see show your doctor and when to meet, because this is the one of a situation. If it will be ignored in an early stage, you can land up with the cancer of uterus, that is called a endometrial cancer. So I just wanted to emphasize a few things. So what is postmenopausal bleeding? The postmenopausal bleeding refers to any vaginal bleeding that occurs after a woman has gone through a menopause. So I just wanted to emphasize a little bit about what is menopause. Menopause is basically defined as the absence of menstrual periods for at least for a 12 months, while some women may experience minimal amount of bleeding after the menstruation. But if the bleeding is increased or it's happening after 12 months of cessation of periods, then that means it's a things to be concerned. You have to visit your gynec and get yourself checked. So sometimes few women experience occasional spotting or light bleeding even after a menopause, and any bleeding that is heavier than or it's prolonged or happening on a regular interval even after menopause, after 12 months of cessation of your periods, that means you should be evaluated by your gynecologist. One of the most common cause of postmenopausal bleeding is the endometrial cancer. Endometrial cancer occurs when the lining of the uterus grows uncontrollably and its surrounding tissues. While endometrial cancer can occur at any age, the risk increases as women get older. Other factors included like obesity, if there is a history of hypertension, if there is a history of diabetes, they used to be a more prone patient for endometrial cancer. So they have to be little more careful than the other crowds. Apart from that, if there is a family history of endometrial cancer or any kind of cancer in your family related with the uterus or even the colorectal or the genital organ, that disease, that they are also very prone for this cancer. So they should be visit the doctors and get themselves checked as early as possible. So it's important to note that not all cases of postmenopausal bleeding are caused by a cancer. Other possible causes includes are also responsible for the postmenopausal bleeding, and these things are hormonal imbalances. If any type of hormonal imbalance is happening in a body, that may lead to the postmenopausal bleeding, or vaginal atrophy, if you're because of the dryness of a vagina, any kind of irritation, and that cracks can cause that postmenopausal bleeding, and patient might get confused with the uterine bleeding. So these are the few common other causes of the postmenopausal bleeding. So that's, I just wanted to emphasize, it's not necessary if you are having a postmenopausal bleeding that means you are a patient of a cancer. So that to be not, but definitely you should visit your gynec and get yourself checked. That is very, very important. So apart from other things, you must know about what are the other important things which to be done if you are having a postmenopausal bleeding. So these are the things you should that should not be ignored. If you are having a associated any kind of pain or foul smelling discharge, so these are the signs you have to visit your doctors. So if postmenopausal breathing is present, it should not be ignored and you have to visit definitely. And early detection is the key of a management of the endometrial cancer or any kind of bleeding which is happening in case of endometrial postmenopausal period. So if then what to be done, what you have to expect to be done, or if you will visit your gynec. So usually your gynecologist used to do the pelvic examination. They will ask you for the ultrasound, vaginal ultrasound, that is called a transvaginal ultrasound. And with that we are able to know ki what is the reason of your postmenopausal bleeding. It's just because of the local cause, like as I said. So because of the atrophy and the eroded surface you are bleeding, or there is a hormonal imbalance, or any lesions, or the uterine lining is getting thick. So because of that reason, if it's your uterine lining is, like suppose in your ultrasound reveals that your thickness of the endometrial lining, that is the lining of a uterus, is thick, that means you need a further investigation and the patient should go for the further investigation, that is called an endometrial biopsy. For this, we used to advise a patient to go for a hysteroscopy in the endometrial biopsy. Hysteroscopy again is a procedure where we used to visualize the uterus through a laparoscope, through lens. We insert the camera without any incision or cut in a body, and that is a daycare procedure through which we used to visualize the uterus. You rule out any other reasons, any other fibroids or any kind of mass inside a uterus, or we used to take a scrap of a endometrial lining to send for the histopath examination, that is called a biopsy, endometrial biopsy. And if the biopsy reveals any kind of problem related with the hormones, so that patient needs a hormonal therapy, or if it reveals any lesions related with the cancer cells, so accordingly patient needs a treatment as per the things. So most important thing is you should never ignore any kind of bleeding which is happening after the cessation of a periods, or especially if you are a patient, if you are a person who is obese, has history of thyroid disease, history of hypertension, history of high blood sugar, diabetes. So they are the one who are more prone for the endometrial cancer. They should not ignore it, and they have to visit and get yourself checked and get your ultrasound done and visit your gynec for the further checkup and management accordingly. So this is what I just wanted to say. And along with that, I just wanted to say that any elderly women in menopausal age group, they should get themselves checked on for a screening. Even they are not going through any problem, then also they should get themselves checked for other reasons, and they screened out for the cancer cervix, for the endometrial cancer, for the breast cancer. So all the above 40 women to get themselves checked. And even if you are going through, you are less than the 40 years of age, or so you can opt for the vaccines which is available for the few cancers like cancer cervix. So these are the options are available, and you should go for all these things. So thank you so much. And any question or any queries, I will be happy to answer your question. I'm audible.